All right, welcome to Chapter 9, Nutrition. Major point to start with here is that registered and licensed dietitians and nutritionists are authorized to provide nutrition counseling, medical nutrition therapy, and meal plans. Fitness professionals who are not also registered or licensed dietitians or nutritionists can provide general nutrition guidelines, direct clients to credible nutrition resources, refer clients to dietitians and nutritionists, and provide accountability and support with dietary changes. It's an important distinction to make between the scope of practice between a fitness professional who may not have registration or license in those dietary areas versus a registered and licensed dietitian and nutritionist who is going to be able to provide more of those clinical level of advice and meal plans and nutrition therapy. So just be aware of that in your practices. You are able to provide accountability and support, and you're able to direct people to the right resources that are qualified professionals, but don't get too specific in your meal planning or your advice beyond just general nutrition guidelines and accountability with their more of the behavioral side of things. Credible and reliable nutrition information includes peer-reviewed research and scholarly resources. So it's not what you read on the internet or what your friend did or what worked for you. The credible and reliable information is based on peer-reviewed research and scholarly resources. Protein is comprised of 20 amino acids, 9 of which are essential and must be obtained via the diet. The role of protein is the synthesis of tissues, organs, hormones, enzymes, and peptides. So protein is specifically meant to be a building block. It's not necessarily the best fuel source. Dietary sources of complete proteins include soy and animal foods such as meat, poultry, seafood, and dairy. Plant-based incomplete protein foods include legumes, grains, and vegetables. So when you're thinking about making food pairings in order to achieve obtaining all of the essential amino acids, sometimes in a plant-based diet, you're going to have to pair things appropriately to achieve that. Whereas those meat, poultry, seafood, and dairy sources tend to have all of those essential amino acids. From a caloric standpoint, protein contains 4 calories per gram, and the recommended daily allowance for protein is 0.8 grams per kilogram of body weight. And this is considered a minimum to maintain nitrogen balance. I think if you read most sources, especially ones that are more up to date and becoming more and more aware of this, will put a slightly higher amount listed here for the protein. And the amount, the AMDR, right, like their daily recommendation for protein is 10 to 35% of our total calories. Carbohydrates, another of your macronutrients, include simple sugars, complex carbohydrates, glycogen, and fiber. Carbohydrates are an important energy source of exercising individuals and athletes. Dietary sources of carbohydrates include plant foods and dairy, including grains, vegetables, legumes, fruit, milk, and yogurt. So there's a lot of different sources of carbohydrates. Simple sugars include the monosaccharides, which would be your glucose, your fructose, and your galactose, as well as disaccharides, being lactose, sucrose, and maltose. Complex carbohydrates are long chains of glucose units called polysaccharides, which are slower to digest and will raise the blood glucose levels slowly. So simple sugars and disaccharides are going to increase your blood sugar levels, your blood glucose levels pretty quickly, whereas those complex carbohydrates are slower to digest and will raise those blood glucose levels more slowly. Sources of complex carbohydrates include starches, legumes, and vegetables. The glycemic index reflects the effect of a carbohydrate on blood sugar levels. So low GI foods cause smaller rises in blood glucose compared to high GI foods. And Glycemic load is a better indicator of a carbohydrate's effect on blood sugar levels because it accounts for the glycemic index as well as the quantity of carbohydrates consumed. So that's just a differentiation between the glycemic index versus the glycemic load. Carbohydrates, just like protein, contain 4 calories per gram, and glycogen is the storage form of carbohydrates in animals and humans. Glycogen is stored in the liver and as well as in skeletal muscle. Fiber is indigestible carbohydrates associated with various health benefits and includes both soluble and insoluble fiber. The daily recommendation for carbohydrates is 45 to 65% of calories in the diet. Important one to note here would be our fiber recommendations. For women aged 19 to 50 years old, we're going to see that there is a 25 to 28 grams of fiber in a day that women should be getting. For men between that same age, 19 to 50, we're looking at more like 30 to 34 grams of fiber each day. Lipids are commonly referred to as fats and include triglycerides, phospholipids, and sterols. Saturated fat sources include animal fats, full-fat dairy, coconut, and palm oil. Polyunsaturated fat sources include omega-6s, which would be our nuts, our seeds, our oils, and omega-3s, which include fatty fish, flaxseed, walnuts, chia seeds, fortified milk and eggs, dairy from grass-fed cows, and green vegetables. And then monounsaturated fat sources include olives, olive oil, avocado, peanuts, and canola oil. Phospholipid sources include meats, egg yolks, seafood, poultry, soybeans, and grains. Sterols sources include cholesterol from animal foods, egg yolks, and plant sterols. Lipids contain 9 calories per gram. So if we look at those three, they're protein and carbohydrates are both 4 calories per gram, whereas lipids or fats are 9 calories per gram. So there's much denser of a fuel source. And the daily recommendation for lipids is 20 to 35% of your total calories. So it was 10 to 35% of your calories from protein, 45 to 65 from carbohydrates, and 20 to 35 from our lipids. Vitamins and minerals are inorganic compounds essential to regulating metabolic processes such as energy metabolism. Deficiencies and insufficiencies can contribute to health issues. Obviously, we need to get enough vitamins and minerals. Hopefully, we can get that through our diet, but obviously, we can also have a supplementation with multivitamins to supplement that. Vitamins include 2 main groups, fat-soluble and water-soluble. So vitamins A, D, E, and K are fat-soluble, essentially just meaning that in order for them to be absorbed, they need to be taken in with fat, but that they have a greater chance for toxicity. They're not like water-soluble vitamins. Water-soluble vitamins, if we have too many, we can simply pass them through our digestive tract, and that you will pee them out. Those fat-soluble vitamins, you can potentially have too much of them. But the easiest way to remember them, A, D, E, and K, are that all dogs eat kittens. I know it's gruesome, but it's an easy way to remember it. Water-soluble vitamins include vitamin C and Bs. The B vitamins being thiamine, riboflavin, niacin, folate, B12, pantothenic acid, and biotin. Another easy one to remember for those is that tender romance never fails. A balanced diet with a wide variety of minimally processed foods will likely supply adequate vitamins. Right? If we have a good balanced diet, we're probably going to get enough of our vitamins and minerals. Minerals include major minerals and trace minerals. So just be mindful of that. Fluid recommendations for the general population would be approximately 11.5 cups a day of fluid for women and 15.5 cups for men. And that comes out to for women, that 11.5 cups is 2.7 liters. The 15.5 cups for men is 3.7 liters. Hydration guidelines for athletes include 12 to 16 ounces of fluid for every 10 to 15 minutes of activities longer than 60 minutes. So just make sure that we're hydrating. We don't want to do it all at once, but we want to try to progressively rehydrate ourselves when we're participating in longer activities. Athletes should replace fluid at 1.25 times the amount of body weight lost during an event. So simple ways just to weigh yourself pre and post event, and then just replace the fluid lost. Sports drinks may be hypotonic being a lower concentration than body fluids, isotonic being similar concentration as body fluids, or hypertonic, it's a higher concentration than body fluids. Sports drinks are likely unnecessary for short duration exercise lasting less than 60 minutes, unless in a hot or humid environment. And strategy combinations are used to help clients achieve their weight goals, primarily including modification of energy intake and physical activity. Typically, that's the best combination to effectively achieve weight goals, is a little bit of both our physical activity and our energy intake adjustments. Again, going back, the first law of thermodynamics states that energy cannot be created or destroyed, but only converted from one form to another. Weight gain is the result of energy intake exceeding our energy output, whereas weight loss is the result of energy output exceeding energy intake. Other factors that may influence weight include sleep, medications, and endocrine disorders. Food labels convey information on the nutritional value and content of products via the nutrition facts panel and the ingredients list. Food labels can help clients make informed decisions about how a food item contributes to their nutrition and fitness goals. Fat loss requires a net calorie deficit, but with the goal of minimizing loss of lean body mass and any reduction in total daily energy expenditure due to adaptive thermogenesis. So, right, that's the key difference, I think, between weight loss and fat loss, is we're not trying to lose lean body mass when we're looking to reduce fat. Adequate calorie intake, especially adequate protein intake combined with resistance training, remains an essential element for increasing muscle mass. Nutrition strategies for improved sport performance are numerous and include ensuring adequate energy, right, our calorie intake, and macronutrient intake. Meal timing and hydration are also important to maximize sport performance. Like we saw when we're thinking about hydration, it's going to play a major role in how close to the event we're trying to hydrate, or potentially how far out or during the event. Just some important concepts, obviously not an exhaustive list of nutritional concepts, but just from a energy standpoint, are macronutrients as well as alcohol energy. So we saw earlier that protein is equals to 1 gram of protein is equal to 4 calories. Carbohydrates, those are 4 calories per gram as well. Lipids, our fats, are 9 calories per gram. And then alcohol has 7 calories per gram. The list of our amino acids, right? These are not essential for you to know, but they are essential for your body to obtain through our diet. The essential amino acids would be leucine, isoleucine, valine, methionine, phenylalanine, threonine, tryptophan, lysine, and histidine. Whereas our non-essential ones are alanine, arginine, aspartic acid, asparagine, cysteine, glutamic acid, glutamine, glycine, proline, and serine. And then conditionally essential amino acids are histidine, arginine, and glutamine. A complete protein is a protein source that provides all of the essential amino acids, whereas an incomplete protein is a protein that lacks one or more of the amino acids required to build cells. Our RDA for protein, which is 0.8 grams of protein per kilogram of body weight. Probably elevated. These numbers would probably be more for someone looking to build muscle. That is a low number, I think. Acceptable macronutrient distribution ranges, that's our AMDR, would be 10 to 35% for protein, carbohydrates 45 to 65%, and then lipids or fats 20 to 35%, and that's an important one to know. Definition here, triglycerides. The triglyceride family is composed of fats and oils, and it comprises 98% of the stored lipids in the body and approximately 95% of the lipids in foods. Very important to know the differences are main fat-soluble vitamins and our water-soluble vitamins. Remember, fat-soluble vitamins are A, D, E, and K. All dogs eat kittens. And then water-soluble vitamins are mainly your C and your B vitamins. And then finally, just to remember your fluid intake for women on a general day outside of activity increases. We want to see 11.5 cups per day or 2.7 liters. And for men, 15.5 cups per day or 3.7 liters. And that is your nutrition.